So I thought I would just start at the beginning and remind everybody that the Affordable Care Act that was adopted 5 years ago, one of the main goals of the Affordable Care Act was to extend health insurance coverage to all people legally in the United States. A way to make health insurance affordable is done in several ways in the Affordable Care Act. First of all states already have a Medicaid program. So what the Affordable Care Act did was create these exchanges, the marketplaces, where people could go shop for private health insurance, but they could get tax credits, tax premiums, tax credits to help them pay for their health insurance premiums that they buy through the marketplace. The other way the Affordable Care Act was going to make sure that there was affordable health insurance for everybody was to require a Medicaid expansion so that instead of every state having a mishmash of different programs, there would be a uniform Medicaid program nationwide. So everybody had a place to go. You'd go to either current Medicaid, the new Medicaid expansion, or to the marketplaces where you could buy private insurance all the way up to 400% of the poverty line. The Affordable Care Act provides 100% federal funding for that Medicaid expansion piece, okay, for 3 years, 2014, 2015, and 2016. Okay, and thereafter, that federal contribution to the state's Medicaid programs would slowly ratchet down, but it would not go lower than 90% of the cost of that expansion. It was determined that Virginia could bring into the Commonwealth $2 billion a year of federal money. Again, our tax dollars coming back to Virginia for the Medicaid expansion. And that $2 billion a year does not just evaporate. It covers health services. It goes to hospitals. It supports jobs, and the estimates are 30,000 jobs would be supported. It sounds pretty good, doesn't it? Why wouldn't any state want to do such a thing? Well, the problem was, and the real wrench in the works came in 2012, when the Supreme Court, looking at the first challenge to the Affordable Care Act, decided, okay, the Affordable Care Act is legal, you could require people to have health insurance, you could require employers to have health insurance for their employees, but we rule that the Medicaid expansion is an optional piece of the Affordable Care Act. Okay, you can't force states to do this. So as a result of that Supreme Court decision in 2014, it truly upset the apple cart completely. You know, instead of a law that had a place for everybody to fit in, you know, Medicaid, Medicaid expansion, or the marketplace, instead of that, the Supreme Court decision took out the whole middle. So next slide. So it's led to a great deal of controversy and debate all around the country. Here is a map of where the states are right now. And I did bring handouts of my presentation that y'all could get later. But Virginia is in the orange, along with 21 states that have still not expanded their programs. But 29 states have expanded their programs, and one state, Montana, the legislature has adopted expansion, but they're waiting for certain waiver changes from the federal government, so they're not quite there. So it's basically 29 states that are moving forward with expansion, and the rest of the states have not. So look at Virginia. And look at your neighbors. Edgar was talking about Maryland and D.C., about driver's licenses. Well, guess what? Maryland and D.C. have Medicaid expansions. So does West Virginia. So does Kentucky. So does Ohio. A lot of our neighbors bordering Virginia. So you can see those green states that have a robust Medicaid expansion. And in those states, I mean, the new enrollments are just huge. As you can imagine, there's just a large, millions of people in this country don't have access to health insurance, and they're primarily low-income people, working low-income people who work 1, 2, or 3 jobs that don't offer health insurance coverage, and they are in this Medicaid gap right now that we have in Virginia. Our current coverage is very limited. Anybody who works in the healthcare arena knows that. And when you look at Virginia compared to other states, it's true. We're 44th in per capita Medicaid spending. That means most other states spend more per person in their state on their own Medicaid program. This was even before Medicaid expansion. So even in Northern Virginia, which is a very high cost of living, if you are a family of 3 earning a nickel more than $10,200 a year, your kids will get coverage, but the parents won't, okay? A family of 4, it's just $12,000 a year. If you earn a nickel more than $12,000, the kids can get coverage, the parents cannot. These are very low-income families. That's half the federal poverty line, okay? And, okay, that's parents. What if you're just a low-income person working hard? You could have 0 income and not get Medicaid. You know, you've got to be a child, a pregnant woman, a parent, elderly or disabled to get Medicaid. If you're just low income, no coverage no matter how poor you are. That last bullet, the kids who get Medicaid up until their 19th birthday, well, what happens when they turn 19? They sing happy birthday, but the next day they still have asthma, they still have allergies, they still have problems, they still need to see a doctor. But that's when they lose Medicaid, they fall into this Medicaid gap. Even people who are declared disabled by Social Security, depending on their income, the lowest income disabled people can get Medicaid, but above that level, you're going to wait 2 years to get Medicare. Now, here's something I want you to listen carefully to so we don't get confused. There are up to 400,000 people who could qualify for the full Medicaid expansion. About half of those are stuck in a Medicaid gap where they can't get Medicaid and they can't go to the federal marketplace. Okay, so here's a graphic. If you have over 100% of the poverty line income, you can get health insurance through the marketplace. That's the kind of work that Rosalia and Lenny are doing through the Enroll Virginia project. If you're over 100% of poverty, you can get those tax credits. But frankly, it doesn't work very well for you. That's the picture to keep in your mind. The Supreme Court created that hole in our health system. Okay, next slide. So what's happened? I mean, we've been advocating for this since the ACA was adopted. So I'm getting tired here. But we have to keep struggling and keep working together to make sure this Medicaid expansion gets adopted in Virginia as soon as possible. We started, because the federal funding was going to start in 2014, we started our big efforts back in 2013 with Governor McDonnell. He basically said no expansion until we reform our Medicaid program. And so we got stuck with a commission looking at a variety of ways to improve the existing Medicaid program. And I should tell you, a lot of those reforms, they're fine. I mean, I support reforms. I just think we should also be expanding coverage. There are a lot of reforms in place, saving the state money. So we have complied with the direction of the General Assembly. Now, in 2014, that was when Governor McAuliffe took office. He ran, his platform included Medicaid expansion, and you'll recall in 2014 we had a major effort to expand coverage. And in fact, we got legislation through the state Senate to have a program called Marketplace Virginia, which would have effectively expanded Medicaid coverage to all those adults who we're talking about. But it was in the Senate. It was not in the House of Delegates. So that's what led to that major budget battle and major gridlock that ended up with the General Assembly adjourning without a budget, and it led to special sessions in March and June, and ultimately there were not the votes in the Senate to get this thing actually adopted. Well, I mean, the Senate wouldn't pass the right budget language in their budget to enable the governor to do what he wanted to do on this issue. But absolutely the opposition, the strongest opposition to this is coming from the House of Delegates. Last year, you know, battle weary, everybody was pretty battle weary. We still promoted Medicaid expansion with bills and budget language. But as we just last week we had primaries in Virginia, and in an election year, it was very difficult for anyone to move off of their opposition position, given the fact that there were elections coming up, and they were, the issue came up in many primaries, and the issue will come up in all of the contested races that we're dealing with this November. So in terms of 2016, we will be back. We never give up until we're done. So we will be back promoting the Medicaid expansion. Of course, it is now, 2016 will be a presidential election. So it's going to be difficult. It continues to be a very uphill climb. Meanwhile, we are forfeiting that $2 billion a year of the tax dollars that Virginians have paid to the federal government, not coming back to serve the population, to help hospitals, and to support Virginia's economy. So we need all of you to be engaged in this. And as many speakers have said today, elections do matter.